Hello friends, welcome back with another video. In this video I am going to start with antimicrobial drugs of choice. So let's get started. Drugs of choice for cholera is doxycycline. Drugs of choice for chlamydia is tetracycline, like example doxycycline. Drugs of choice for tropical sprue is tetracycline. Drugs of choice for relapsing fever is tetracycline. Drugs of choice for Rocky Spotted Mountain Fever tetracycline. Drugs of choice for tick typhus is tetracycline. Drugs of choice for Scrubs typhus tetracycline. Drugs of choice in syphilis is penicillin G. Drugs of choice for toxoplasmosis is cotrimoxazole. Drugs of choice for Legionella is erythromycin or levofloxacin. Drugs of choice for lymphogranuloma venereum is azithromycin. Drugs of choice for Kala Azar is sodium istivogluconate. Oral drug of choice for Kala Azar is miltefosine. Drugs of choice for plague is streptomycin. Drugs of choice for brucella is streptomycin. Drugs of choice for tularemia is streptomycin. And drugs of choice for rhinoscleroma is streptomycin. Drugs of choice for acanthamycosis is penicillin G. Drugs of choice for leprosy is dapsone. The most effective drug agent Mycobacterium leprae is rifampicin. Drugs of choice for herpes zoster is valacyclovir. Drugs of choice for herpes simplex acyclovir. Next one, drugs of choice for influenza is oseltamivir. Drugs of choice for blood fluke is praziquantel. Drugs of choice for lung fluke also praziquantel. Drugs of choice for typhoid enteric fever is IV ceftriaxone. Drugs of choice for leptosporiosis is penicillin. Next one, drugs of choice for scabies is permethrin. Oral drug for choice for scabies ivermectin. Drugs of choice for filariasis is diethyl carbamazine. Drugs of choice for Listeria monocytogenes is ampicillin. Drugs of choice for Enterococcus faecalis is ampicillin. Drugs of choice for toxoplasmosis is cotrimoxazole. Drugs of choice for toxoplasmosis in pregnancy is pyramycin. Drugs of choice for schistosomiasis is praziquantel. Drugs of choice for leishmaniasis amphotericin B. Drugs of choice for aspergillosis is amphotericin B. Drugs of choice for roundworm excariis is albendazole. Antihelminthic drugs. Drugs of choice for pinworm is Enterobius vermicularis or albendazole's antihelminthic agent. Drugs of choice for hookworm is albendazole. Drugs of choice for bipworm albendazole. Drugs of choice for trichiaworm is albendazole. Drugs of choice for guinea worms is albendazole. Drugs of choice for hydatid disease albendazole. Drugs of choice for filarial worm is ivermectin. Drugs of choice for threadworm is ivermectin. Drugs of choice for pork tapeworm is praziquantel. Drugs of choice for beef tapeworm is also praziquantel. Drugs of choice for fish tapeworm is praziquantel. Drugs of choice for dog tapeworm is praziquantel. Drugs of choice for dwarf tapeworm is praziquantel. Drugs of choice for liver fluke is triclavendazole. Drugs of choice for blood fluke is praziquantel. Drugs of choice for lung fluke is praziquantel. Drugs of choice for community acquired pneumonia is clarithromycin. Drugs of choice for surgical prophylaxis cefazolin. Drugs of choice for pneumocystis RNA cotrimoxazole. Drugs of choice for cholera in children is cotrimoxazole. Next one, second line drug of choice for filariasis is ivermectin. Drugs of choice for tapeworm infestation is praziquantel. Drugs of choice for strong glycodiasis, which one called threadworm, is ivermectin. Drugs of choice for river blindness or onchocerciasis is ivermectin. Drugs of choice for tetanus is metronidazole. Drugs of choice for listeria ampicillin. Second line drugs of choice in listeria is SMZ-TMP, sulfamethoxazole and trimethoprim. Drugs of choice for MRSA is vancomycin. Drugs of choice for vancomycin resistant staphylococcus aureus is linezolid. Drugs of choice for neonatal meningitis is ampicillin plus third generation cephalosporin. Drugs of choice for bacteriocytes fragilis is clindamycin. Drugs of choice for pseudomonas colitis is metronidazole. Drugs of choice for amoebiasis is metronidazole. Drugs of choice for trench mouth also metronidazole. Drugs of choice for bacterial vaginosis is metronidazole. Drugs of choice for amoebic liver disease is metronidazole. Drugs of choice for trichomoniasis is metronidazole. And drugs of choice for gardiasis is metronidazole. Drugs of choice is extraluminal amoebiasis is metronidazole. Drugs of choice for antibiotic induced colitis is metronidazole. Drugs of choice for anaerobic infection metronidazole. Drugs of choice for gonorrhea is ceftriaxone. Drugs of choice for H. pylori eradication is metronidazole. Drugs of choice for whooping cough erythromycin. Drugs of choice for cat scratch disease erythromycin. Drugs of choice for Campylobacter infection erythromycin. Drugs of choice for gonococcal urethritis azithromycin. Drugs of choice for chancroid azithromycin. Drugs of choice for legionellosis is azithromycin. Drugs of choice for trachoma is azithromycin. Drugs of choice for inflamed acne is minocycline. Drugs of choice for cystic acne is isotretinoin. Drugs of choice for urinary tract infection is norfloxacin. Next one. Drugs of choice for Plasmodium vivax is chloroquine. Drugs of choice for Plasmodium falciparum is artemisinin combination therapy, which one include artesunate, pyrimethamine and sulfadoxine. Drugs of choice for cerebral malaria is artesunate. Drugs of choice for malaria is chloroquine. Drugs of choice for chloroquine resistant malaria is also artemisinin combination therapy, which one include artesunate, pyrimethamine and sulfadoxine. Drugs of choice for brucella is streptomycin with doxycycline. Drugs of choice for candida is fluconazole. Drugs of choice for aspergillosis is voriconazole. Drugs of choice for dermatophytosis is topically azole. Systemic glycylcephulvin. Drugs of choice for Chagas disease is benzinazole and nitroximox. Drugs of choice for dysuria is phenazopyridine. Drugs of choice for gonorrhea is procaine-penicillin. Drugs of choice for syphilis is procaine-penicillin. Drugs of choice for rickettsial infection tetracycline. Drugs of choice for plague tetracycline. Drugs of choice for anthrax is doxycycline. Drugs of choice for toxoplasmosis is trimethoprim sulfamethoxazole. Drugs of choice for Haemophilus influenza type B rifampicin. Drugs of choice for prophylaxis of tuberculosis is isoniazid. Drugs of choice for diarrhea in HIV patient is octreotide. Drugs of choice for acyclovir resistant herpes is foscarnet. Drugs of choice for hepatitis B is limouvidine. Drugs of choice for hepatitis C is ribavirin and interferon 2 alpha. Drugs of choice for lava migraine albendazole. Drugs of choice for inflammatory sulfasalazine. Drugs of choice for prophylaxis of newborn to TB mother is INH. Drugs of choice for accidental exposure of HIV to healthcare worker is zidovudine with lamivudine. Drugs of choice for salmonella ceftriaxone. Drugs of choice for meningitis ceftriaxone. Drugs of choice for gonorrhea ceftriaxone. Drugs of choice for resistant pneumococcal infection is ceftriaxone. Next one. Drugs of choice for filiar worm is diethyl carbamazepine. Drugs of choice for platyhelminthes perisequental. Drugs of choice for trichomoniasis is metronidazole. Drugs of choice for extended spectrum bacterial lactam is carbapenem. Drugs of choice for otitis media amoxicillin. Drugs of choice for nocardia sulfonamide. Drugs of choice for neurocephalus aqueous penicillin. Drugs of choice for donavenosis azithromycin or doxycycline. Drugs of choice for Neisseria is ceftriaxone. Drugs of choice for cryptococcus for induction is amphotericin. For maintenance fluconazole. Next one. Drugs of choice for neurocystic cirrhosis is albendazole. Drugs of choice for typhoid enteric fever is IV ceftriaxone. First line drugs for tuberculosis include 5 drugs: rifampicin, isoniazid, pyrazinamide and ethambutol and streptomycin. Drugs of choice for tuberculosis and renal failure is rifampicin. Drugs of choice for prevention tuberculosis in susceptible individuals is INH. Drugs of choice for treatment tuberculosis and HIV positive patient taking protease inhibitor is rifabutin. Drugs of choice for MDR strain for tuberculosis is amikacin. Drugs of choice for latent tuberculosis INH. Drugs of choice for INH resistant patient for latent tuberculosis rifampin. Drugs of choice for leprosis rifampin. Drugs of choice for lepra 1 reaction glucocorticoids. Drugs of choice for lepra 2 reaction glucocorticoids. Treatment of choice for multivessel leprosy rifampicin, fidepsone and clofazamine. Drugs of choice for hot water-borne tuberculosis in hospital is M. Genopi, is clarithromycin. Mycobacteria genopi is clarithromycin. Drugs of choice for cutaneous TB caused by atypical mycobacteria is clarithromycin. Drugs of choice for meningeal prophylaxis is ciprofloxacin. Drugs of choice for meningococcosemia is ceftriaxone. Drugs of choice for post-splenectomy sepsis is ceftriaxone. Next one, drugs of choice for gram-negative sepsis is piperacin or tobramycin. Drugs of choice for gram-positive sepsis, vancomycin, genthamycin. Drugs of choice for toxic shock syndrome, group A streptococcus is penicillin with clindamycin. Drugs of choice for necrotizing fasciitis is group A streptococcus penicillin. Drugs of choice for prophylaxis of cardiac lesion in infective endocarditis, amoxicillin. Drugs of choice for impetigo is penicillin G. Drugs of choice for meningococcal meningitis, penicillin G. Drugs of choice for severe falciparum and chloroquine-resistant malaria is quinine. Drugs of choice for enterococcus faecium is linezolid. Drugs of choice for animal bite, amoxicillin. Drugs of choice for otitis media, amoxicillin. Drugs of choice for dirty bound prophylaxis is cefazolin. Drugs of choice for pneumococcal pneumonia in adults, amoxicillin. Drugs of choice for typhus fever is chloramphenicol. Drugs of choice for lice infection 1% permethrin. Drugs of choice for dental prophylaxis infective endocarditis, clarithromycin. Drugs of choice for cellulitis, oxacillin. Drugs of choice for severe infection in penicillin allergy patient, vancomycin. Drugs of choice for microspora is albendazole. Drugs of choice for serious upper respiratory tract infection is aminoglycosides. Drugs of choice for serious upper respiratory infection by atypical pathogen, doxycycline. Drugs of choice for endocardial prophylaxis in patient allergic to penicillin, vancomycin. Drugs of choice for histoplasmosis, amphotericin B. Drugs of choice for invasive streptococcal infection, clindamycin. Drugs of choice for dermatitis herpetiformis is aspirin. Drugs of choice for cryptococcus, fluconazole. Drugs of choice for bulbovaginal candidiasis, fluconazole. Drugs of choice for pyrazinamide-induced hyperuricemia is aspirin. Drugs of choice for systemic fungal infection is amphotericin B. Next one, drugs of choice for CMV retinitis is ganciclovir. Drugs of choice for condyloma acuminata is podophyllin.